This is actually a big debate in the field in terms of when you should use chemoembolization and when you should use radioembolization. And unfortunately, there are very few studies that can really guide the choice between chemoembolization and radioembolization. The only studies that we have comparing the two are non-randomized, and so there's inherent selection bias in terms of who receives chemoembolization versus who receives radioembolization. Overall, when you look at the data, I think the data suggest that the two are pretty equivalent in terms of effectiveness. But chemoembolization has a much stronger evidence base behind it. The other thing that we notice is that patients may tolerate radioembolization better than chemoembolization with lower rates of post-embolization syndrome. But without high-quality data to guide us in terms of the choice between chemoembolization and radioembolization, you see a large variation in terms of practices across the country. So it's very interesting because some people who have localized disease that's small in nature, some centers will routinely treat with chemoembolization. Whereas if that patient was seen down the street, they would routinely get radioembolization for that very same cancer in the very same patient. And really it's just a matter of which center you're seen in and the local expertise. At our center, we tend to use radioembolization for patients who have a larger tumor burden where you're afraid that either they're going to have significant post-embolization syndrome or that you won't get a very good effect from chemoembolization. And so radioembolization can definitely be considered in this person. It's just that we don't have great data comparing it to the effect of chemoembolization.